Hello, family and friends. Today, for Men's Health Awareness Month, we're going to talk about prostate cancer, a disease that impacts 1 in 8 men during their lifetime. According to the CDC, prostate cancer is the second most common cancer in men and the second leading cause of cancer-related deaths, just behind lung cancer. While prostate cancer can be serious, the good news is that most men diagnosed do not, let me repeat myself, do not die from it. If caught early, prostate cancer is highly treatable. In fact, 99% of men diagnosed early are still alive 5 years later. Thanks to early detection and better treatments, many men live long lives with the disease. According to the most recent data from the American Cancer Society, in 2024, approximately 299,000 new cases of prostate cancer and 35,000 deaths were reported. Unfortunately, Black men continue to be disproportionately affected with higher rates of diagnosis and mortality than other racial groups. This may be due to a combination of genetics, access to care, environmental factors, and delayed diagnosis. So what is prostate cancer? Prostate cancer is a type of cancer that begins in the prostate gland, a small walnut-sized gland located just below the bladder in men. This gland helps produce fluid that keeps sperm healthy. Most prostate cancers grow slowly and may not cause symptoms for years. However, some can be aggressive and spread quickly. Early detection is key, as prostate cancer caught early is often highly treatable. Now let's look and see who's at risk. You may be at increased risk for prostate cancer if you're over 50. Risk rises significantly with age. You are of African American descent, have a family history of prostate or breast cancer, are overweight or obese, have been exposed to certain environmental toxins, including pesticides, live in an industrial or high pollution area, have a diet high in red or processed meat. So what are the symptoms to watch out for? Often there are no symptoms in early stages, but as it progresses, signs may include frequent or urgent need to urinate, especially at night, weak or interrupted urine flow, blood in the urine or semen, erectile dysfunction, pain in the lower back, hips, or chest. Now let's look at how prostate cancer is detected. There are 2 common screening tests. The first is a digital rectal exam. In a digital rectal exam, a healthcare provider inserts a gloved, lubricated finger into the rectum to feel for lumps and hardness or irregularities in the prostate. Next is a PSA blood test. It measures prostate-specific antigen levels. A high PSA level may suggest cancer, but it's not specific, and many things can raise one's PSA. There are non-cancer causes of elevated PSA, which include benign prostatic hyperplasia, prostate infection or inflammation, urinary tract infection, recent ejaculation within 48 hours, vigorous exercise, especially cycling, and testosterone supplements or anabolic steroids. On the other hand, there are certain medications that may lower your PSA, such as aspirin, ibuprofen, cholesterol-lowering drugs such as Lipitor, blood pressure medications such as thiazides, diuretics, and Propecia, a medication for male pattern baldness. By lowering one's PSA, it may mask a true high PSA and lead to false negatives. That's why it is essential to tell your doctor every medication you're taking before your PSA test. Lastly, when should you begin screening? For men at average risk, screening should begin at age 50. For men at high risk, including African American men and those with a family history of prostate or breast cancer, screening should begin at age 45. Now, if you have multiple family members diagnosed, early screening should begin at age 40. So talk with your doctor to determine the right time to begin screening. Well, that's it for today. Join me next time when we will discuss what happens after a diagnosis of prostate cancer.